What if I told you that right now, as you're sitting here watching this, high blood pressure could be quietly destroying your heart, your brain, and your kidneys, and you feel absolutely nothing? That's not a scare tactic. That's a medical fact. Doctors call high blood pressure the silent killer, and for good reason. Over 116 million Americans have it. Nearly half of them have no idea. And after age 40, your risk skyrockets. But here's the terrifying truth nobody's talking about. High blood pressure does send warning signals. They're just so subtle, so easy to brush off as normal aging that most people completely miss them. Today, on Senior Secret Clinic, I'm going to walk you through all 5 of those silent warning signs. By the end of this video, you'll know exactly what to watch for and what to do if you spot them. So stay with me, because sign number 3 is the one most people laugh off, and it could be the most dangerous of all. Welcome back to Senior Secret Clinic, the channel dedicated to helping men and women over 40 take back control of their health, naturally and confidently. If you're new here, hit that subscribe button and ring the notification bell right now, because every week we drop life-saving health content designed specifically for people in your season of life. Now, before we get into the 5 signs, let me ask you something. When was the last time you had your blood pressure checked? If you're hesitating, that tells me everything I need to know. And that's exactly why this video is so important for you today. Blood pressure is measured in 2 numbers. The top number, systolic, measures the pressure when your heart beats. The bottom, diastolic, measures the pressure when your heart rests. A healthy reading is 120/80 or below. Anything consistently above 130/80 is considered high. Above 180/120 is a hypertensive crisis, and that's a 911 emergency. But here's what most people don't realize. You can have blood pressure of 160/100 and feel perfectly fine. No headache, no dizziness, nothing. And that whole time, tiny blood vessels in your brain, eyes, and kidneys are being silently damaged. That is why catching the subtle signs matters so much. Let's go through them one by one. Sign number 1, morning headaches that fade by midday. Here's one that almost every person over 40 has experienced, and almost no one connects to blood pressure. You wake up in the morning with a dull, throbbing headache. It's not a migraine, it's not sharp, it's just there, heavy, sitting at the back of your head or around your temples. And here's the strange part. By the time you've had your coffee and gotten moving, it's gone. So you think, must have slept on my neck wrong, must be stress, must be dehydration. You move on. You forget about it. Don't. Blood pressure naturally peaks in the early morning hours between 6 and 9 a.m. because of hormonal changes and the physical act of waking up. When your blood pressure is already high, this morning surge puts intense pressure on the blood vessels in your brain, causing that dull, heavy headache. As you get up and start moving, your body adjusts, vessels dilate, and the headache fades. But the damage that happens silently every single morning over months and years. Ask yourself, have you been waking up with headaches 3 or more times per week? Does it tend to be worse on days when you're stressed or didn't sleep well? Is the pain at the back of your head specifically? If you answered yes to any of those, that's your body sending you an SOS. Write it down, track it, and get your blood pressure checked, not just once, but several times across different days and times. Sign number 2, vision changes, blurring, spots, or floaters. Here's something that might surprise you. Your eyes are actually one of the few places in your entire body where doctors can literally see your blood vessels without cutting you open. And high blood pressure damages those vessels, quietly, progressively, and permanently if left unchecked. The early warning signs include blurry vision that comes and goes, spots or floaters that suddenly appear, difficulty adjusting to bright light, or, and this one is serious, sudden double vision or loss of peripheral vision. Now, many people dismiss these symptoms because they assume it's just getting older. And yes, some vision changes are a normal part of aging, but sudden floaters, blurring episodes, or vision that seems to pulse, that's different. That's your vessels screaming for attention. Hypertensive retinopathy, the medical term for eye damage from high blood pressure, affects millions of Americans. It can lead to permanent vision loss if blood pressure isn't controlled, and often the eye symptoms come before a stroke warning. The bottom line, if your vision is changing in any way that feels new or sudden, don't wait for your next routine eye exam. See a doctor now. Mention blood pressure specifically. Sign number 3, shortness of breath during light activity. This is the one I promised you, the sign that people laugh off more than any other. And it's the one that scares cardiologists the most. You walk up a flight of stairs. You carry groceries from the car to the kitchen. You walk from the parking lot to the mall entrance, and suddenly, you're winded. You meet a moment. Your heart is pounding harder than it should be. And you think, I'm just out of shape. I need to exercise more. I'm just getting older. Here's the truth that could save your life. When your blood pressure is chronically elevated, your heart has to work harder with every single beat. Over time, this causes the heart muscle itself to thicken and stiffen, a condition called left ventricular hypertrophy. Your heart becomes less efficient, less flexible. It struggles to keep up with demand, even light demand. The result? You run out of breath doing things that used to feel easy. This isn't just fatigue. This isn't just aging. This is your cardiovascular system waving a red flag. If you notice you're getting short of breath during activities that wouldn't have bothered you a year or two ago, combined with any other sign on this list, please take it seriously. Talk to your doctor about getting an EKG or echocardiogram to check your heart's function. These are simple, painless tests, and the information they give you, potentially life-saving. Sign number 4. Frequent nosebleeds. Now, let me be clear. A nosebleed on its own, especially in dry weather or after bumping your nose, is usually nothing to worry about. But here's the key question. Are you getting nosebleeds more frequently than usual, with no obvious cause? Sometimes heavy and hard to stop, because the delicate blood vessels inside your nasal passages are highly sensitive to blood pressure. When pressure is elevated, those thin vessel walls are under constant strain. They can rupture easily, sometimes spontaneously, without any trauma at all. Studies have shown that people who show up at emergency rooms with severe nosebleeds are significantly more likely to have uncontrolled high blood pressure. In some cases, the nosebleed was the very first sign they had any blood pressure problem at all. If you've had more than 2 or 3 nosebleeds in a month, especially if they were hard to stop or seemed to come out of nowhere, add this to your list of symptoms to bring to your doctor. And if you ever have a nosebleed accompanied by a severe headache, vision changes, or chest pain, call 911 immediately. That combination can signal a hypertensive emergency. Sign number 5. Irregular heartbeat or pounding pulse in your ears. Have you ever been lying in bed at night in total silence, and you can actually hear your heartbeat pounding in your ears, or feel your pulse throbbing in your neck or temples? This is one of the most overlooked warning signs of high blood pressure, and it has a specific medical name: pulsatile tinnitus. Unlike regular tinnitus, which causes a constant ringing, pulsatile tinnitus is rhythmic. It pulses in sync with your heartbeat. Why does this happen? When blood pressure is high, blood flows through your arteries with more force than normal. That force, that extra turbulence, can become audible, especially in the quiet stillness of the night. Along with this, some people notice heart palpitations, a fluttering, racing, or irregular rhythm that seems to come and go without warning. While palpitations have many causes, they're also a known consequence of the heart working under increased strain from high blood pressure. If you've noticed either of these, a pounding you can hear or feel in your head, or irregular heartbeats, please don't dismiss it. Mention it at your very next medical appointment, or sooner if it's happening frequently. What you need to do right now. All right, you've now learned the 5 silent signs. Let's talk action, because information without action is just noise. Step 1. Get a blood pressure monitor for your home. You can find a reliable one for under $30 at any pharmacy. Check your blood pressure at the same time every morning, before coffee or exercise, and log the numbers. Take that log to your doctor. Step 2. Cut your sodium intake. The American Heart Association recommends no more than 2,300 milligrams of sodium per day, ideally closer to 1,500 milligrams for most adults over 40. That's less than 1 teaspoon of salt. Start reading labels. You will be shocked at how much sodium is hiding in restaurant meals, canned foods, and even bread. Step 3. Move your body daily. You don't need to run a marathon. A brisk 30-minute walk, 5 days a week, has been shown in clinical studies to reduce systolic blood pressure by 4 to 9 points. That's as effective as some medications, without the side effects. Step 4. Reduce alcohol and eliminate smoking. Both directly spike blood pressure and damage blood vessel walls over time. Step 5. Manage your stress. Chronic stress keeps cortisol and adrenaline elevated, which in turn keeps your blood pressure elevated. Practice deep breathing, meditation, prayer, journaling, or whatever healthy outlet works for you. This is not optional. This is medicine. Your next step starts right here. Here's what I need you to do right now, before you close this video, before you check your phone, before you do anything else. Number 1. Drop a comment below with one word: checking. If you're committing to getting your blood pressure checked within the next 7 days, that one word holds you accountable. And when you see others writing it too, you'll know you're not alone in this. Number 2. Share this video with someone you love who is over 40. Your spouse, your sibling, your best friend, your parent. You could literally save their life today by sending them this video. High blood pressure doesn't care how healthy someone looks. Anyone can have it. Everyone deserves to know. Number 3. Subscribe to Senior Secret Clinic right now if you haven't already. Every single week, we bring you honest, evidence-based health content designed specifically for men and women over 40. No fluff, no filler, just the truth your doctor sometimes doesn't have time to tell you. Number 4. Hit that like button. It's free. It takes 1 second, and it tells YouTube to show this video to more people who need it, people who might be walking around with dangerously high blood pressure right now and have no idea. You watched this far because you care about your health. That means you're already ahead of most people. Now take the next step. Your heart has been working for you every single second of your life without stopping. Not once. Give it the care it deserves. I'll see you in the next video. Take care of yourself, because you matter, and your health is worth fighting for. Senior Secret Clinic, because the best years of your life are still ahead of you. Subscribe, like, share, comment.